Well, it's hip to listen to Dr. Joel Saylor. It's hip to be square sometimes too. This week we're going to be talking about hip dysplasia. Good morning, doctor.
So you said it's hip to listen to me, but then it's also hip to be square. So ergo, you're saying I'm a square.
No, or we are.
Well, I would agree that we are.
Okay.
I'm not. I think I am too.
It's this 2010 shirt I'm wearing.
Yeah, I've been a lifetime nerd, card carrying nerd since I was in high school.
You played chess in school, didn't you?
No, but I was a band geek, so
Okay,
that's the way it goes.
Did you play the tuba?
No, I play saxophone.
All right.
Yeah.
You got the girls, didn't you?
No, that didn't happen until I got married, and then I've certainly married way above my station. But
Station WEAG.
There you go. All right, so enough on that. So I want to talk a little bit about hip dysplasia. That's a diagnosis that kind of gets bantered around. I think sometimes we overuse it. Hip dysplasia, by definition, refers to congenital malformation of the hips. Okay, dysplasia, if you look at that word, that means abnormal growth. Okay, so basically hip dysplasia is going to be a young dog that has abnormal hips, and very early on in life will start exhibiting symptoms of osteoarthritis, oftentimes as early as 1 to 2 years of age. Now, let's contrast that to the 9 or 10-year-old dog that's got arthritis, okay, and they're limping and stuff, and say, oh, he's got hip dysplasia. No, he probably doesn't. He's got hip osteoarthritis, but he doesn't have hip dysplasia, because a dysplastic dog, a truly dysplastic dog, is usually going to display symptoms or signs early on in life, because as the name would denote, it is an abnormal development. Okay. Now, hip dysplasia itself, you want to know early on, because if you know early, there are things that can be done. Okay. Later on in life, if you haven't addressed it in that under 2 year of age, by the time you get out to 6 when they're crippled, okay, then you're talking about total hip replacement. Okay, and that is doable. I mean, we have several facilities that can do a total hip replacement, get your dog back to you within a couple of days, and they got a bionic hip and they're doing great.
But you'd rather not go that route.
We'd rather not go that route. Yeah. Now, if you have a dog that's hip dysplastic and you identify that dog and they're under 2 years of age and they don't have any degenerative changes to the hip, there's a procedure called a TPO, triple pelvic osteotomy. It's easier to say TPO. So what the TPO does is they take that socket, okay, and they free it up from the pelvis and they change the angle. So in essence, this hip is slipping, so they rotate the socket up so it fits in there nice and tight. And the research is very good on this, because they've been doing TPO since I was in school. So we've got 25 years of track record with this technique. And if it's done under 2 years of age, those dogs can go on to lead fairly normal lives, and they don't need the total hip replacement, and they don't develop the arthritis, and that joint stays in there and solid. So when you're talking about a dog, if you got an older dog that's 10 years old, never had any problems prior to that, but now it's showing some lameness back there, it's probably osteoarthritis associated with old age. If you've got a dog that's 10 years old that's crippled, that has been progressively, since it was say 2 or 3, developing that was probably hip dysplasia. Okay?
And we'll be back right after this.